Hi there, Todd Cameron here, general practitioner, medical director and founder at M3 Health. This video is made for members of our community that are 70 and above, which happens to include my mum and a lot of her mates, so this video is for your benefit. What I wanted to chat to you a little bit about is give you some clarity around COVID-19, explain to you a little bit about what it is and what measures are sensible measures to take to make sure that you protect yourself. The first thing is the virus is actually called SARS coronavirus 2, and the illness that results from getting that virus is called COVID-19. So it stands for coronavirus disease 19, and as we know, this started in probably around about November 2019 in the city of Wuhan, Wuhan in the province of Hubei in China. As a result of that, the spread has been fairly global, and at the point in time that I'm actually making this video, there are around about 50 cases in Australia, but there has been person-to-person transmission, and cases that we're worried about have related to people that have recently travelled to hotspots. That includes China, parts of northern Italy and Iran. But we're very quickly going to see things changing to advice about all illnesses. One of our challenges in Australia is this is going to be overlaid on a flu season, so things are going to become really confusing for a lot of people, and we're also seeing lots of behaviours in the community that we haven't seen before, and so it's really sensible to try and say, okay, well, it looks like that there's going to be a pandemic of this particular virus. Coronaviruses are really common viruses, just generally speaking, and usually they cause symptoms like the typical cold, but in the past there have been more aggressive versions like SARS and MERS, both of which were able to be controlled by containment measures. Unfortunately, in this case, it doesn't look like we've been able to contain it. So a couple of important things. There are two numbers that are important with any viruses. One of them is what's called the R0. The R0 is how contagious something is. I won't worry about the exact number because it does change depending on the community that we're talking about. But the reality is this virus looks to be more contagious than the flu as a comparator. And then the other one that's important is what's called the case fatality rate. So what proportion of people that get the virus actually die from the virus. And again, that varies depending on the community we're talking about, but suffice to say it's probably around 10 times more dangerous than the flu. So this is likely to be a really serious time for infections. And the people who need to worry about are people 70 and above. So if you look at the case fatality rates, no child 10 or under has perished as a result of this infection. Between 10 and sort of 50 to 60, there's around about the same rate as what really bad flu season is in terms of case fatality rates. Then above 60 it starts rising, above 70 it gets more substantial, and getting to the point where above 80 it has a case fatality rate somewhere around about 15%. So that means that 1 in 6 people thereabouts who contract this above the age of 80 are likely to die from it. And there's a lot of people in between that may need hospitalisation and advanced care. So some really, really important things that we need to do to actually make sure that we reduce it. So going back to the virus, at the moment the information suggests that it's spread by droplets, so it's coughing and sneezing, and also fomites. That means things that we pass to people, smooth surfaces in particular, or surfaces that you touch, handrails, grips on the train, all that kind of stuff. So it's able to be spread through those areas. It probably can live on surfaces for some period of time if you're not cleaning those surfaces. How long? Well, look, it's really hard to know exactly how long, but there have been cases that are at least several days. The incubation period is usually between 4 and 10 days. Again, there are circumstances where it's been a lot longer. The median, so the vast majority of incubation is around about 7 days. So what are the things you need to do? Well, this is a handy piece of doweling that I grabbed from Bunnings just last night. It's 1.8 metres long, and where the tape is 1.5 metres. We need to bring into play social distancing measures. So I'm going to say some stuff that might be a bit distressing because it's part of our long-held habit and part of our culture. No kissing, no hugging, no handshakes. 1.5 meters is the minimum distance you should be away from people that are sick. Doesn't mean you need that distance away from people that are well, but if they're little kids, you probably shouldn't be hugging little kids in this environment, because little kids can actually have the virus and remain quite well, not even have mild cold symptoms. So if you know someone's unwell, 1.5 to 2 meters, preferably don't be around them. If you're 70 and above, I wouldn't be going to the grandkids' birthday parties at this point in time. That might sound like a really hard thing to avoid, but if you know that there's coronavirus in your area, that's probably a hotbed for it, and you're much more likely to pick that up. We want to reduce the demand on the health system and avoid having a spike in demand, because what that means is that people aren't able to get the care that they need. So stay away from environments where there's a lot of the public, and avoid touching things that I'm not great at, handrails, public spaces, door handles, all those kind of things. If you do need to, then what I would strongly encourage you to do is not to touch your face. So nose, mouth, eyes, avoid touching that. If you do find you need to sneeze or cough at any point in time, into your elbow, that's going to be much safer, and start getting ingrained those habits about not having the personal contact. So you're probably going to be doing more FaceTime chats with the grandkids and the family than in-person catch-ups over the coming weeks and months, but I want you to start practicing these habits early, because it's going to feel normal to you then. It does make sense that you ought to have some kind of an amount of non-perishable foods that will last you probably 10 to 14 days. That's in the event that you need to self-isolate. So isolation is when you're well, but you've been in contact with somebody that we know has COVID-19. And quarantine is when you're unwell. So, if you're in isolation, that means you can't go out. You're going to be confined to your home, and you might be able to get friends to bring you supplies. But if you think that, I'm just going to call Coles, or I'm going to call Uber, you're probably not the only person thinking that. And so it's better that you don't put extra stress on a system that may not be able to cope, because it's not as if they're expecting everybody to have deliveries at home. So I don't think it's sensible to rely on those things. So ideally, just gently start building up a bit of a stockpile of non-perishables. And if you do need to stay at home, you can. If you do need help from your family and friends, make sure you do that by phone, that you call them and give them updates, let them know what's going on, and they would be able to help you out in that regard. Travel, at the moment, it would be a sensible option to check what's going on in the destination that you're heading to, and make sure that you're using appropriate personal hygiene on planes. Hand washing is the thing I want to chat to you about next. So the other one thing's the distance, the social distancing measures. Avoid touching areas which are shiny surfaces, in particular, that have been touched by a lot of people. Remember, it can be transferred by cards and things like that, credit cards, etc. Make sure that if you need to get to your GP to get some things that you get in early, so as that you get some updates, get some scripts, make sure that you have a little bit of a stockpile where possible of all of the things that you might need over the coming months. That will be a really practical thing to do. Important to remain healthy and connected. It doesn't mean don't go out. It just means be sensible about doing that, and keep on top of what's going on in your area. Hopefully your GP will be actually putting some announcements out. There'll certainly be public health announcements about what you need to be aware of in your area. But as I said, things are moving fairly quickly, and we're seeing behaviours that we've never seen before. So that tells you that this is something that has a lot of people concerned. So really, the best preparation is to make sure that you are prepared, that you are doing practical things, and that you're doing sensible things that mean that you're safe and your family are safe, that everybody's able to get the care that they need, so we don't overwhelm the health system. I hope that's been useful. If you have any questions, put them below, and I can easily update this video in time as more information comes to hand. Thanks a lot. I've been Todd Cameron. Have a great day. Bye.